Hello, I'm Faisal, and welcome to another episode of So What Do You Actually Do? A channel dedicated to students and employees alike further understand their future role. If this is something that interests you, then hey, subscribe and stick around. In this episode, I got the chance to interview Shuaib, who is a travel physical therapist. He talks about his day-to-day, how he got there, and how in his job he restores the mobility and function to patients who've gone through some sort of injury or illness. But more importantly, he talks about the things that he didn't know about prior to starting this job. Things like the disparity of pay of someone who's gone through further education, and also the disrespect potentially that you might get or not get with that title. Second thing he talks about is the different specialties you can go through as a physical therapist and how there are so many of them. It's for you to decide. And lastly, he talks about how he tries to avoid the mill clinics, the ones that try to make the most out of patients with a little bit of the physical therapy actually taking place. So if this is something that really interests you, then subscribe, like, share with those that are interested, and tune in. Today I have the pleasure of talking to Dr. Shuaib. Dr. Shuaib, how are you doing?
How's it going, Faisal? I'm great.
Doing awesome. One thing to note, Dr. Shuaib is in Hawaii, so he is giving us some aloha vibes. It's 9 a.m. his time. Thanks for coming, tuning in, being in the middle of the ocean.
Of course. Anything for you, Habibi.
Thank you. All right, so as I mentioned, a doctor in physical therapy, and there's a lot of interest in this world with how to become one. What is it like to become one? What is the real life, insight to the day-to-day of a physical therapist? And we'll jump into these things in detail. So we'll talk a little bit about the path to becoming a physical therapist. Can you talk a little bit about what kind of education or degrees did you need to become a physical therapist?
Yeah, of course. So as you already mentioned, it is a doctorate degree. So a minimum of 7 years. That's going to be 4 years in undergrad, 3 years in grad school, and then you have the option to do a residency. Undergrad, you can honestly get your degree in almost anything. Of course, whatever you get your degree in, you'll have to do or subsidize that with your prerequisites. I personally got my degree in kinesiology, but I know people who have gotten their degrees in math, um, astronomy, things that make zero correlation with physical therapy. But, they had that shift in career change and they decided they wanted to go to PT school. So they scrapped whatever they started with. They kind of hit their prerequisites and then applied to PT school. In addition to that, you also have to take the GRE, which is kind of standard for most grad schools prior to applying.
So as a travel physical therapist, that was a tongue twist. What do you actually do on your day to day?
On my day to day right now, I'm in a interesting setting, if you would. I'm at a critical access hospital here in Hawaii, which just means that it's a little bit more rural in this area. The closest major hospital is close to like an hour and a half away. So at this critical access hospital, I do a bit of acute care in terms of having an ER that's on site, but we also have patients there that are kind of there long term or in between being able to be placed in another care setting or being able to be discharged home. So we have those patients that are there that are kind of in the middle in terms of where they're going to be going for their next step or next level of care. And then we've got patients that are being admitted for rehab specifically, similar to a skilled nursing type of program where they're going to get admitted and their main goal there is going to be to get stronger and usually go home. Or if we can't get them home, then transition to possibly a long-term care facility to continue
Their care.
whatever treatments and care. Yeah.
Got it. So, how much of your job is physical versus paperwork versus talking with people?
Hmm. Um, that's a In general, most PTs say that they hate the paperwork side, and a lot of times you can get stuck doing paperwork 24, like it feels like 24/7, or it feels like maybe majority of your day is paperwork. Um, I will say, as the younger generation of PTs are coming in, we're a lot more used to typing and being able to put our words on paper compared to the older generation that's kind of having to transition into, they have to learn to use the computers. Before it was just all handwritten documentation. So they're having to deal with that learning curve. As for us, it's more like, okay, yeah, I know I can sit there and just sit clack on the computer and rip out a bunch of notes. So I don't feel like I'm doing it a whole lot of time with a lot of the paperwork. If I was to give random numbers out, I would say maybe 30% of the time I'm doing paperwork, 50% of the time is treatment, like 20% to be talking with patients and family.
What is something you didn't expect about being a physical therapist, or maybe even as a travel physical therapist, until you started doing it?
Well, when I got into PT, I did not know there were so many different layers to physical therapy. As a physical therapist, I was thinking, oh, essentially, only thing I knew was outpatient clinics. I'm gonna get people to come in. I didn't know about working in hospitals. I didn't know about wound care. I didn't know about any of that. So getting into PT and learning all these different avenues has been really interesting. I enjoy wound care. Um, that's something that I've taken an interest in. You do have to deal with a variety of different smells that isn't always everyone's cup of tea. If you got like rotting flesh that's sitting in front of you, you just got to be able to deal with it. But outside of that, I still find it quite interesting and rewarding. I would say that is one aspect, and then the other aspect is the enticing idea of getting your doctorate. Um, in my mind, I was like, okay, I'm gonna get my doctorate in this field, in this program. It should set me apart and put me forward in a lot of ways. But unfortunately, a lot of times we're not treated as a person that has their doctorate or a doctor in general. And the pay isn't what you would expect for someone with a doctorate to get. And that's something that is more on the side of government funding and what we're allowed to do as physical therapists. And that's why it's really important to be, when you become a physical therapist, to be involved in your legislative communities for each state to help better push the PT field forward, to be able to not only keep the name, but make the name something that's worth knowing and can be appropriately paid for, whether it's insurance, whether it's private pay, we know whatever it is. You get this doctorate, you want to make sure that people respect it and that you're earning something that's appropriate for it.
Well, speaking of earning, do you mind sharing with us how much is the range for someone in your level of expertise as a travel physical therapist?
Yeah, so travels physical therapy, like we spoke about in the beginning, because there's so many different specialties, you can range. Obviously, the more specialized you are, the more you can kind of ask for or demand because you have this specialty. And travel physical therapists in general, you're going to get paid more than a full-time PT, and that is because you're providing a service that is in need and that they don't have and can't fill with a full-time or a part-time person. The lowest I've seen for a contract was like 1,500 a week. And then the highest I've seen for a contract, close to four.
So we're
And
ranging, I did a quick math.
yeah,
Uh, we're ranging between 80K to 200K a year.
roughly. Yeah, contracts are usually 3 months, option to extend if you like the facility and the facility likes you. Um, the key to really be able to make the most out of it is trying to reduce how much time in between contracts you have.
Mm-hmm.
When you end a contract, a lot of times you feel like, okay, let me take a breather, take a week off, and then I'll take another contract. But then you also remember that's 1 week that you're not going to be getting paid.
Yeah.
So if you do that too often, then obviously you're going to be missing out on, multiple weeks of pay. It's going to drop your annual income. I personally haven't heard of anybody who's been able to get those high threes all the time. But again, and then you have to think about where you're going. There's
Yeah.
travel time that you have to put into it. A lot of the higher ones tend to be in California because the cost of living is higher there.
Mm-hmm.
So they end up paying you more there. But if you're, let's say, going from Florida to California, you're gonna have to pay for. There's flights you have to do it. Oh, if you don't want to do fly, you want to drive. Some contracts will comp what it takes to get you there up to a certain extent.
Mm.
So they might be like, oh, we'll pay up to $500 for, to get you here. Or some like, okay, just send us a bill for the flight. We'll take care of that. But then if you decide to fly, like me personally, I flew here to Hawaii. But then you have to deal with transportation. You don't have your car here. Shipping a car
Forget about it.
on the mainland, so you can just cut that out because it's not worth it. It's a few grand, and you're like, okay, and you decide to stay there for maybe 3 months. If option to extend 6 months, and then you got to ship it back to the mainland. So there's other details that you have to kind of put into the calculator in terms of cost of living, things like that. But those are the price lines.
You mentioned something with the contract stuff. Do you actively look for another contract, or I'm guessing right now you're working with a company, or
Yeah.
hospital facility of sorts. Do they look out for you and they give you those options towards the end of the contract that you have, and then you decide, yeah, I'll move forward, or I want to negotiate this one. Can you negotiate on my behalf? How does that work?
Yeah. So you have a company that you work for. There's multiple that's out there. In my opinion, the company isn't as important as your recruiter, which is the person that's going to be doing the negotiating on your behalf. That's the person that you really want to have a type A, knows how to put your needs first, is organized in terms of reminding you, oh, you're at your halfway point in your contract. Oh, you've got this many weeks left. Have you decided, or what do you want to do? Do you want to push an option to extend? Do you want to push an option for a raise? Those kind of things. Your recruiter is going to be instrumental in that process. And for me, or my company, and most companies, my company has an app, and on that app you have places that are looking for help. Essentially, all that I do when it comes close to either I have to decide if I want to renew here or if I want to go somewhere else, I check on that app. I'll type in the state that I want to go to, and I'll get a list of places in that state that are hiring. From there, I'll kind of select a few. And from the app, as soon as I click to select it, it gets sent to my recruiter, and my recruiter handles getting it, figuring out what the details are, and then she'll report back to me, hey, these are the ones that you sent me. These four out of the six are still hiring. Let's say two are just decided to go with someone, so they're out of the picture. But these four are solid. She'll give me the price ranges that they're looking for, the schedule that they kind of want to look at a patient, their employee having, and then from that, you essentially say, okay, well, let's do out of those four. I like these three. Out of these three, I want to get paid at least X amount. I want to see if they'll tolerate this schedule instead of that schedule. And she goes, okay, I'll take care of it. She sends it forward again, communicates with them, does that. So really, she'll just report back to me, hey, this is what's going on. Does this sound something attractive to you? Or do you want to say, oh, I'd rather this than that? And then she goes and handles it again. After all that process and you kind of get a few contenders that you want to talk to, she'll be like, okay, they're going to come, they're going to call. Usually it's call because you may or may not be in that state. But usually you're going to be call, do an interview. But the nice thing about travel is you're always interviewing them. They're not interviewing you because they want you. You necessarily don't have to go with them. And that's something to be important, that the ball is going to be in your court. So treat that conversation as such. And during that interview, you're going to be asking questions about what their business model is, how do they like to see patients, what their productivity standards are, what do they expect from me to be able to provide for them. Then you get kind of a good idea of what they are about, what they want, and from that conversation, you can decide, oh yeah, this is going to be a great fit for me, or no, I think we have different ideals and values for our patient care, and you might decide to skew to a different direction.
Makes sense. Very quick, two questions. We have a couple of minutes left.
Yeah, no worries.
On the work-life balance, you mentioned like the business model and productivity. What is the business looking for, and how does that impact you normally in your work-life balance? Like, what are your hours on average that you work a week?
So I keep a fairly full 40-hour a week schedule. When I say business model, most PTs know or understand that there's some clinics that we call mill clinics, and I might just get blacklisted for kind of discussing it. It's a delicate balance in terms of whether you have a mill clinic or you don't. But in general, a mill clinic, the coin phrase is a clinic that you really spend 10 or 15 minutes with a patient in terms of hands-on providing care, and then they kind of get shifted to either doing exercises by themselves or having someone, either a volunteer or another student or a tech working, just kind of watch over them during the exercise. But you don't get to spend that much time with the person because your caseload is so full that you're just kind of bouncing from person to person to person to person to person. You don't really get a lot of time. So it's kind of like a big revolving door where you're just seeing 40, 50 people at a time or in a day. And you really just don't get the opportunity to do or deal with a lot of hands-on care and kind of close monitoring and treatment that me personally, I like to, and I enjoy doing.
Makes sense.
So I try and avoid those type of places that provide that kind of care. And in conversation, I can usually tell during my interview with that company whether or not that is their style or not. Again, it's a business model, and again, these clinics are businesses. So at the end of the day, they are trying to make money, and obviously, the best way to make money is to keep a lot of people coming in and out of the building.
Yeah.
So I can't fault them for that, but at the same time, I always make it clear, because I have worked in clinics like that. I make it clear, okay, I'm gonna do my best to push forward patient care as a top priority rather than the money. So if you feel uncomfortable with that, you can take that. But
Yeah.
I've got plenty of testimonials and things that I'm a great clinician, and most people
Makes sense.
enjoy it.
No, Dr. Shaib, I appreciate your time. We're coming here to a close. So, for everyone interested in physical therapy and specifically travel physical therapy, please share this with your friends. And with that, we end our interview and hope you have a great rest of your day.
I appreciate it. You as well.